So I was going to mention that.
Where are we? Oh,
How are we doing with quorum? Okay, see a lot of great people. I see Charles, you're part of the presentation today. Karen, she's here. Jeannie is here. Christina's here. Linda. Boom, 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 boom. Do, 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 do. Suzuho, do we have quorum or Karen?
Hold on just a second. I just want to introduce Lindsay is on the call. She's our new administrative assistant for public health.
Okay.
And let's see, just doing a quick head count here. We do not have quorum yet that I can tell.
I see Tom Kurt, Josie signing in.
Yeah, and I'm quorum until Greg gets here, so I count.
Yeah.
Okay, then we're actually good, I think.
Okie dokie. So let's make sure everybody is muted. And with that said, I want to flip one more page. Get a sense of who all's here. Okay, okay. Okay, Tom's there. Bill Mattson is here. Okay, I'm going to go ahead and call the meeting to order. And I want to thank everyone for all of your hard work and all the tough decisions and input that everyone is providing. I'm going to ask that if you do want to make a comment, I need for somebody to raise their hand or get attention, because I do think the chat box is turned off. So that's the only way I can recognize each one of you that might want to make a comment. This is a public meeting, even though the board will be making the decisions and will be inviting conversation. With that said, I see Peacock is here now. Okay. Can we put up the agenda on the screen, please?
Lindsay, are you able to pull that up?
Yes, I'm getting it right now.
Okay.
Sorry about that.
Okay, I know the very first item on the agenda will be the minutes of the previous meeting. And I'm sure members of the board have read the minutes. I'll ask for a motion for approval. Tom? Okay, thank you, Tom. Have a second?
Second.
Okay, thank you, Brent. All in support? Unmute and say aye.
aye.
Aye. Aye.
Okay, thank you. Recognizing we've got a lot of discussion topics on our agenda today, I'm going to jump right into the agenda. Charlie, you're first. And Dr. Kim Levin, is she on? I didn't see her. Charlie,
She's aware. She's probably going to pop on. Marky, can I just
Yeah.
lead off
Yes,
quickly,
please.
and then I'll,
Yes.
yeah, thank you. So I just wanted to frame up a couple of the different pieces of the agenda today. And as you're all aware, since May 9th, Pitkin County's moved into that phase 1 of the roadmap to reopening. And there's a number of different components which will be discussed today in regard to that, and that will help to support this phase 1 of the plan. The goal of the phase is really to reduce potential transmission of new cases while still allowing for reopening of organizations and settings. And today's meeting will really focus on 3 components to this necessary during this phase. And the first is the collection of data and the analysis of that data by both public health, epidemiology, and the healthcare system. And so Charlie and Kim are going to present on that data that we've been collecting and really show us a point in time of where we're at. This is the data that we'll continue to collect that allows us to better understand how we continue into phase 2 and eventually phase 3 of the reopening, and really trying to ground all of our decision making in the best data that we have. The roadmap to reopening was developed from Resolve to Save Lives, which is a international pandemic epidemic organization that has some of the best experts in the world on it, including former CDC Director Dr. Thomas Frieden. We're also using Johns Hopkins Center for Health Security as a guiding agency that's putting out a lot of really good guidelines and data for us to use to help inform our decisions. And so I just want to remind the board and also the public that all of the things that we're sharing are grounded in the best research that's out there right now. The second part, or the second component, is really understanding the safer at home public health order that we, in essence, align to with the state and the various processes that go with that. And then the third component is understanding the community stakeholder groups that we've tasked to really determine risk and mitigation strategies in the community and the processes to ensure that employee and customer health and safety are taken at the forefront and really brought to light, and that they're prioritized in the reopening. And so you're going to see those components throughout the meeting today, and there's a lot of opportunity for dialogue and some opportunities to hear from you all. I think one amazing value that the Board of Health brings to all of this efforts is that you're on the ground, you're hearing what people have to say, people are sharing information with you. And sometimes we're not aware of all of those things, and to have the board really be a conduit to us better understanding what the community concerns are, the community issues are. And so we've created space in the agenda today to really hear about what you're hearing on the ground, not to problem solve necessarily in this meeting, but to hear the issues and concerns you're hearing from the members of our community. And so there's space for that as well in the agenda. So lots to talk about as always, and I will kick it over, unless anyone has any questions for me, to Charlie to kind of ground us in the data before we move forward.
Hey, Karen?
Yes.
Yeah, I'm on the phone with Dr. Levin. She can't.
Okay.
Can we please send her another link to Kim?
Sure.
We're going to do it right now, Kim. Okay, well, Karen's sending it to you or her assistant. Yep. Ooh.
Lindsay, are you able to resend that link to Kim?
Yes, I'll do that right now.
Great, thank you.
Okay, pay attention. It should be coming. Let me know if you're not getting it yet. Ugh. Okay, let us know if you don't have it. That's okay. I tell you what, I'm gonna send it over as well. Okay, bye.
I just sent it.
Okay. Thank you very much. Okay, Karen.
Great, so Charlie looks like he's ready to go, and Charlie, it's all you.
Right, you can see the slide there, everybody? Yep, great. Well, thank you, Karen. Thank you, Board of Health. And once again, my task today is to walk you through Pitkin County's criteria and supporting data for moving into our next phase of response to COVID. I wanted to start off with a quick story about how infectious diseases have affected and continue to affect history. This fellow on the screen is Kamehameha II, who was the king of Hawaii at the time in 1824. And he and his wife traveled to London because they didn't really want to become part of the United States. They wanted to stay part of become part of the British Empire. Unfortunately for them, when they arrived in London, there was an outbreak of measles, and they both contracted measles and died of their infections. The heir to the throne, Kamehameha III, was only 12 years old at the time, and he never followed through on that plan to annex to the British Empire. So Hawaii in 1898 became part of the United States. Barack Obama was born in 1961, a US citizen instead of a British citizen, and was able to become president of the United States. There we go. So history is being no less affected today by the coronavirus. And I know we'd all like to go back in time and prevent this from happening or disturbing our way of life. You know, I kind of liken it to an exhilarating fresh powder day on Aspen Mountain, catching an edge and blowing out your knee. You wish you could change that moment in time, but now you have to deal with the consequences of your ability to ski or even walk without pain, and it's all going to be forever altered. This spring, summer, and fall of 2020, and to some degree, our lives as we know them pre-COVID will be forever altered by this virus and moment in time. City, county, and state governments, nonprofits, and businesses have to plan for at least a gap year to adjust to this new environment and give researchers time to develop antivirals and a vaccine. The decisions we make today will write the history of how well we balanced the medical and economic impacts and recovered from this virus. So the question is, are we ready? And what does the data tell us to take the next step? You've seen these 5 different criteria before. These are the criteria for moving forward, that we have a sustained decrease in cases, the hospital can safely treat patients, testing is performed on all people, we can actively monitor and trace cases, and people continue to socially distance and identify if they're symptomatic. So we're in the process of breaking these down further now into epidemiologic, healthcare, and public health considerations, as well as developing specific data analysis to drive decision-making around the indicators. So Dr. Levin and I are going to review kind of the progress that we have on some of that data. I'm going to take kind of the first epidemiologic points. She's going to talk about the healthcare strategy side, and then I'll come back and talk about the public health side. So hopefully she made it onto the call here. The first criteria is, you know, stable or decreasing cases in the context of increased testing. As of yesterday, we've done 228 PCR tests. 18 of them were positive, 179 negative, and 31 are still pending. So the positivity is less than 10%. This graph shows the cases by date of onset of symptoms. And although we've had some cases reported more recently, they were serology tests, and the date of onset of the actual symptoms goes back to about early April. So from this standpoint, from the confirmed cases by date of onset, we're looking good. The second epidemiologic criteria is decreasing numbers and proportion of cases that aren't linked together. We don't want, the concept here is that even given an increase in the cases, if they were all in one household, for example, that'd be a lot easier to control than if there were 3 different cases from all around the community. And because of our limited number of cases, we really haven't seen that yet. So we're still looking good there. The next thing we look at in terms of our epidemiologic criteria is stable or steady decrease in influenza-like illness seen in our community. And this graph shows you from our community tracker, symptom tracker, that we've had a big peak in March. It kind of died off into April, and we've seen very little for the last month. So we're looking good here. We're continuing to monitor similar graphs from Garfield and Eagle County as well, which show a similar picture. And then the fourth criteria is that looking at how stable the cases are in adjacent counties. And to compare those, we look at the cases we have in a day and then compare that to a 7-day average. So we're not, just looking at little blips in time. Right now, Pitkin County is on, and this is state data, is reporting 54 cases, 2 deaths, no new cases on May 12th, and our 7-day average was 0, so we're stable. Eagle County is a little bit more active, but their new cases are about the same as their 7-day average, so they're stable. Garfield County kind of surprised us the other day and reported 8 new cases, but when we checked into it, it turned out those were a catch-up kind of reporting error for serologic cases as well, so they're stable. And Colorado, if you look at the new cases on May 12th, it was 278 versus a 7-day average of almost 400. So they're actually decreasing in terms of their trend. So again, we're looking good. We've left this kind of as a caution area because we are seeing in many states that have eased suppression strategies that cases are increasing. So we're not sure yet whether some of the changes we've already made here in Colorado, that we're still waiting for the data to catch up with us or not, based on what we're seeing in the other states, but we're going to continue to monitor that closely. And then we're going to try and tie this to other big data points. This is a graph of traffic counts comparing 2020 to 2019. And you can see we're just starting to see the rise in our traffic counts go back up, which correlates to the opening of landscape and construction, as well as just people starting to move around a bit more. CDPHE is working with a company that monitors mobility data as well, and we're going to be able to get more specific information by county and even by industry to compare, to look at that and how people are moving around. And then finally, we want to try and monitor airport passenger traffic, both commercial and private, restaurant and bar activity, lodging occupancy, and among other big data points, so that we can correlate any new cases to what's actually happening. Our goal is to know as much as possible about where cases come from so that we can be surgical as opposed to blunt in our response. So that's just some of the data that we're looking at from an epidemiologic point of view. And Kim's going to tell you a little bit now about the data on the hospital side. And Kim, I'll stop sharing. Kim, you're going to share your slides directly?
I will. Thank you, Charlie.
Okay.
Okay, great. I'll share some slides in just a minute. Charlie, thank you so much for that excellent and concise introduction and very thorough review of all the epidemiology that we have at this point. I just want to review again. We're looking at the 5 criteria, which Charlie just went through the epidemiology. I'll go through the healthcare and the Aspen Valley Hospital side of the data. And the 5 criteria that I'll address is Pitkin County sees a sustained decrease in the number of new COVID-19 cases for at least 14 days. So that's the first criteria. The second is that hospitals are safely able to treat patients without resorting to crisis standard of care. And then the third one is that testing is performed for all people with symptoms with COVID-like symptom infection, and so that we have testing in place. And then the 4th and 5th are more public health. So I'll be looking at the first 3, and I'm going to share the data for the first 3. Again, I just want to reiterate and just go through one more time, as I did last week, that the data, this is a data-driven process, and we want to keep this we recommend to keep this a data-driven process. In order to look at data and fully evaluate data to make the next steps that are the best steps to make, it depends on the life cycle of the virus. So the virus has a it has a wide incubation range from 2 to 14 days. So if you take the maximum 14 days of an incubation period, which means the first moment that somebody is exposed to the virus to when they start having symptoms showing, it can be up to 14 days. And that's what drives our 14-day quarantine. The recommendation for having enough time to look at data to make this a data-driven process is 2 life cycles of the virus. So 2 generations of the virus are needed. And that also looks at this R0 number. So R0, again, just very simply because it's a technical number, is the number of people that one person infects on average. And that changes. So it was believed to be somewhere from 2 to 3. We think that we've suppressed it at this point in our community, which drives the R0 down. So if we have one person whose incubation period ends up being up to 14 days, that let's say that one person infects 10 people, if we look at the data at 14 days, we will not have enough information to make the right next steps. So we need at least 2 life cycles, which is up to 28 days at minimum, to be able to look at the data and to adequately say that we are ready to make the next steps. If that one person infects 10 people and each of those infect 10 people, we have 100 new cases on our hand. It's an exponential growth. And so it's so important to be able to get enough data before you take the next step to open up. I just wanted to reiterate that. And then the other thing to really think about as we look at the data is May 9th was 4 or 5 days ago. So we certainly are not going to see the effects of a significant opening that occurred on May 9th, which is the step from the safe at home to the safer at home step that we took. So we had non-essential businesses open up. We had personal businesses open up. We had a lot open up on May 9th. And so the data that we see today will certainly not reflect any of that opening. Now we're 3 weeks out right now from construction and landscape opening. So potentially we might see some numbers, but again, we don't have enough time to adequately see what we might be seeing from that opening. I think the traffic numbers might indicate that a little bit earlier. So let me see if I can share my screen. Can you all see that okay?
Yes.
Okay, great. So this first one, and you've seen this graph before, and it is up to date at this point. This is the number of patients at AVH with COVID symptoms. So this is looking at the first criteria that Pickens County is seeing a sustained decrease in the number of COVID cases for at least 14 days. And again, the number of patients is on this left side. And then these are dates. So it starts on March 1st and we go all the way until May 12th. What we are seeing is from April 13th or so, we are seeing, now that's a whole month now, we are seeing that we are very stable over the past month. We are operating under capacity at Aspen Valley Hospital. On average, there is 1 patient in the hospital over the past 4 weeks. We have 2 patients right now. So it's a very small number of admitted patients. So most of the patients that are seen with COVID-like symptoms are sent home from the ER, or they're tent patients that were never even in the hospital. They were outside the hospital. And so they're all outpatients. So this is a very sustained for over a month that we are well positioned at this point. We are in hospital capacity and we're able to treat everybody safely. This next one is looking at, so this is a graph that looks at the daily visits to the Aspen Valley Hospital respiratory tent. As you all know, there's a respiratory tent in front of the hospital that is treating patients with COVID-like symptoms in a safe and efficient manner in the tent using PPE, where patients don't need to, it was a solution where patients do not need to go to separate outpatient offices and they don't need to use resources of the ER, that they're kind of an in-between moderate patient. And these are the tent numbers. And as you can see, these are really low numbers. On the left, this is up to from 0 up to 8. And on the horizontal axis, it's March 23rd over to May 12th. up to date. And so during that period, these numbers are so low, and it's when numbers are very low in terms of data analysis, it's very hard to see if there's any type of a trend. But I think they've just been stable. There hasn't been any marked increase or decrease. And again, there's a very small number of patients who are admitted. So I just want to remind everyone one more time that May 9th opening, this will not reflect a May 9th opening. There's not enough time to look at that. This may potentially start reflecting after 3 weeks of the construction and landscape opening, but I don't think it's reliable. So there's really no definite trend here. This last graph looks at the percent of AVH staff with COVID-like illness. So one of the criteria is that hospitals are safely able to treat patients without resorting to crisis standard of care. And really looking at healthcare worker cases is an indicator that will be tracked over time in terms of the healthcare worker workforce and the capacity for the workforce. So at Aspen Valley Hospital, currently there's 414 employees. There are 2 that are out currently, but as you can see here, this is the percentage of total at Aspen Valley Hospital that are out with COVID-like illness. And then again, these are the dates. So really the height of the percentage of patients and the number of healthcare workers who were out of the workforce really is end of March, early April, up to when it started really decreasing here. That looks like April 8th. And the increase was from the middle of March. And so now we are really down to a low percentage that are out. So the workforce is in and the workforce is ready, and we have the capacity at that point. Also, the hospital, I want to remind everyone, has a surge place and plan to handle any increase in demand. There is adequate PPE at this point and masks, which are the most critical piece at this point for the volume that we're treating. That's it for the graphs that I have. I just want to make a couple more points here. The third criteria is that testing is performed for all people with COVID-like symptoms in the community. The testing started at April 24th, as you know, in a testing site in front of the hospital. We have enough staff and we have the ability to test any patient that has COVID-like symptoms in our community at this point. There has, as Charlie had said, that there were a couple that tested positive recently, one on May 5th and one on May 10th. But as he mentioned, those symptoms had started earlier. And so that bar graph that he showed is really more accurate at this point. At the capacity that the hospital has is 16 patients a day right now. We can increase that to 32 patients a day. And it's operating at 7 days a week. So we certainly have the capacity in place. Despite testing is kind of tricky. So if we see an increase in testing, which we have over the past week, we have seen an increase. Our biggest day was on Friday. There were 27 patients that were tested. And on Monday, we had 21 patients. So this is a marked increase in the patients that are being tested. Now, that doesn't necessarily mean that we have an increase in our community. There are many factors involved with why more people might be getting tested. And one of them could certainly be that there's more education going out, and there's more education that it is so important for everybody to get tested as soon as possible, to get into the tent and to get tested, so that the public health system of Box It In can really be effective and take and capture everyone that has symptoms. So anyone that has symptoms, we don't know that this increase is because there's been an increase in education in terms of all of this. The other is that there's the removal of the ability to pay as a barrier to testing. So the hospital did not want to have any barriers to testing because, again, entering this whole Box It In system is going to be the most important piece, and having available testing and having education to get everyone in and decreasing the barrier of paying for it all of that has been achieved up to this point. So I think that's it for the data. And as we move along through this whole process, there will be more data presented and we'll be trending this. So the point is to really trend all of this over time. So we will see if there are changes over time and we can make decisions as we go along. This is a really dynamic process. So we all wish that we could say, hey, we know that we're going to be able to open up on this date and be predictive about that and see into the future. We're in a situation where there's no roadmap. We've never done this before, and we're trying our best. And if we make our decisions based on data and based on these data, it's a dynamic process, and it really requires continuous feedback and continuous decision making as we walk through this. And if we find as a community that we've made decisions to open up too early and we see a spike, we would make decisions then to close down and become more restrictive. And it's just going to be this dynamic process. That's how I see it, and requires flexibility and understanding on all parts. And it also requires the 5 commitments as everyone goes along. The 5 commitments that each individual in our community commits to: the 6-foot distance, washing hands, covering your face in public, staying home when you're sick, and getting tested immediately if you have symptoms. And if we all move along, kind of committing to these and practicing these, I think we can open up we're going to be the best situated to make these openings as we go along. I do want to mention, and I know Charlie mentioned this as well, that there have been a couple of cases. Let me just get my notes here. The danger of resurgence. So will we see an increased number of cases as we make openings? I believe we will. And our goal is not to have 0 increased cases, because we know that we're on this tightrope, that we're walking this balance, and really the economic toll and the economic pressures to open up are real, and we can't sit where we are. So we need to make steps forward. So our goal is not 0 new cases. Our goal is a really controlled and the limited lowest number that we possibly can get as we go along, so that we have the fewest deaths from this. There have been examples recently in South Korea and in Wuhan, China, which maybe you all have read about. So in Wuhan, they lifted strict lockdown in early April. They enjoyed 35 days without a new case. And then just recently, there's been a cluster. And so they've had a resurgence. And that, the reason why I bring this up is 35 days is even greater than 28 days. So they had a cluster and resurgence after 35 days. And so again, that kind of creates the importance of at least 4 weeks of data to be able to look at this. So now they're dealing with that. Their goal is to test everyone in the entire city of 11 million people. China is operating very differently than we are in terms of testing. Also, it occurred in South Korea, which has been praised as the model internationally in terms of public health control. Their first case was the same as the first case in the United States, the same day. They've only had 300 deaths in South Korea. They started loosening social distancing and lifting restrictions, and now they have a resurgence. And so this will likely happen, and we really want to control it as much as we can. Again, the goal is to save lives, while at the same time walking this tightrope of opening up economically. So it's delicate, it's complex, it's going to be decision-making as we go along. And then in the United States, there have been some states that have reopened early, and there's a resurgence that's been noted in Texas in particular. And every state's doing things differently. And so every state is a little bit of an experiment. I know Georgia opened up really early against some advice, and we're just closely watching to see. So I also want to note that even though you've seen in the United States, like in New York and New Jersey, that the numbers are markedly going down there, it is noted that the national numbers have remained high on average. So there's still 30,000 new cases a day and 2,000 new deaths a day. in the United States. So the numbers are still really high, even though some of these areas are coming down, and it might give you the false impression that like throughout the United States it's coming down. It's not, and in some cases it's going up, as I mentioned in Texas. So it's really a risk-benefit analysis as we take every step. And more data will be coming, and we'll be sharing these data as we go along and sharing these graphs, and there'll be more graphs and more robust data, and we'll really be looking at our trigger points and the points at which we all become uncomfortable with this and potentially need to make a step back. But again, it's day by day and it's step by step, and it'll be a group effort.
I have 2 questions, and Karen, perhaps you can answer that. Some people are sending in questions to my iPhone. The chat feature is on, so you can send your question through chat. First question is, many of our construction workers live in Garfield County. So how do we know the impact of construction because they're not getting tested in Pitkin County? Is that shared amongst the counties? What industry?
Yeah, and I'll also turn to Charlie, but so if someone tests positive in Garfield County, if they're a Garfield County resident, regardless of where they work, that information gets sent to Garfield County Public Health as they start to do contact tracing. If they contact trace back to someone who might be a resident of Pitkin County, we're then alerted to that contact tracing through that contact tracing process. And Charlie, do you want to add anything to that?
No, I think that's correct. I mean, we're going to follow up. We did have someone test here because we don't know if it was a construction worker, but someone that tested positive that lives in Garfield County, and so we referred the case to them, and they were going to do the contact tracing. But there is cooperation. We're talking quite often with Eagle and Garfield County to coordinate our efforts.
Okay, thank you very much. That was a concern that I think many of us had. The second question comes from, we opened construction on 4/26 and you were using the date of 5/9. Why is that?
The question was, construction opened in April, in late April, but May 9th was a big step to safer at home for this community. And so it's a separate step. Yeah, it's when the non-essential businesses opened and personal services and a lot opened on May 9th that we took that separate step earlier with just construction and landscape. So I think would be interesting to see if just the construction and landscape as we approach that 4-week mark, if that alone is going to be creating an increase.
Thank you very much. Okay.
So I'm going to share, thank you, Kim. So we've kind of gone through the epidemiology side and the hospital healthcare side. Now I'm going to talk a little bit about the public healthcare side. And in the near future, we're going to be able to break down these criteria much more. The medical advisory team is going through it in detail through ABH and working on that right now. So we'll have more to report to you in terms of data going forward. Share.
Okay.
We're back on. So from our public health criteria, kind of the biggest issue that we're going to have is getting people to be identified and tested right away. And I've kind of lined out along here some scenarios in terms of how long it takes for various stages. You could imagine somebody maybe flying into the Aspen airport that was exposed 3 days ago. They land, onset of symptoms may not be on average till about five days. So they could be infectious and already exposing other people without even knowing that they have symptoms. then they're out and about town, and a day or two later they develop symptoms and decide, maybe I should call my doctor, maybe I should get referred to the tent, and that may take another day or two. So already we're up to 4 or 5 days of exposure out there. Then the average number of days from a specimen collection to a PCR test result can be another 1 to 2 to 3 days, sometimes longer if it's over a weekend. But that's been coming down. We've been working on that. So again, that adds more days to it. Possibly we can get them isolated at that point. And then once we get that PCR result, we start contact tracing the same day usually. But you can see how this can add up and how one person's exposure can, if they're out and about town, they could expose a lot of people. So we want to make sure that patients get recognize the symptoms and get tested as soon as possible. And that's going to involve public messaging, employer screening to make sure that anybody that employers see that are calling in sick get tested, and maybe eventually for discussion, some sort of airport screening where incoming passengers would be given a welcome to Aspen package that includes how to recognize symptoms, where to seek testing, details of the current public health order, what's open, what's not, and maybe get contact information for them when they're going to be in town so we know where to get a hold of them if somebody else on the plane was sick and we needed to contact trace them. The second kind of criteria that we look at on the public health side is the PCR test itself. And right now, sending it out to labs or to the state lab can result in 2, 3, 4, 5 days to get results. So we're taking steps, and Aspen Valley Hospital is taking steps to maybe bring some of that testing in-house at some point to help increase or decrease that time. If we could get the test results in less than 48 hours, that would be an improvement. The third criteria for public health is that all cases are interviewed for contact tracing. So we do have our team of contact tracers in place. We've been able to work with the city of Aspen, who's been a great partner, as well as other county departments to train people to be contact tracers. And unfortunately, we haven't had a lot of cases. So one of the next steps we'd like to do with them is kind of some one-on-one shadowing through a complete trace so they get more defined training, but that'll happen over time. We have a couple of outstanding hires that we're still looking for a couple of supervisors for that group. And we also need to look at in order to handle larger volumes, some efficiencies, software for reporting. And I wanted to bring in Kurt, if he has a chance right now, to talk a little bit about kind of what's happening on the software side.
Good afternoon, everyone. Marky, can you hear me?
Yes.
Yep. Okay. Thank you.
We got you.
Thanks, Charlie. We just wanted to talk a little bit about technology. We've had a few people reach out to the department with some questions around technology. And in terms of contact tracing and case investigation, we're working with the state health department. They are in the process of looking at software to help manage the data around contact tracing and case investigation. They're looking at 8 different types of platforms, and they're in the selection process right now, looking at hopefully having a selection by May 31st. After that, we're not sure. I think they're still looking for funding to actually roll it out, but this would be software that would be utilized across the state to help manage the data around contact tracing and case investigation. Right now, our team's using Google Sheets, and while it works, and sitting through a couple of the reviews, obviously this is just going to make our process a little more streamlined, a little more easy to manage the data and easier to share it. So I'm really happy to see that we're doing that. I know a couple of people have forwarded us emails about some software manufacturers that have contacted us locally looking to see if we're interested. At this point, I think given the state's involvement, it would be the best choice would be to be consistent with the rest of the state in terms of whatever software we use so that we're able to share information, we're able to share resources around that. So I think we should wait and see what selection has been made before we move forward with that. So we are working on it, but I think we just wanted a couple people to know that it'll take a little bit, but we've got hopefully some solutions coming.
Perfect. Thank you, Kurt.
Mm-hmm.
So the fourth criteria for public health is that all positive cases and contacts are isolated and quarantined. We do have all the scripts developed and we have a process in place. We want to make sure that, again, we can apply technology as necessary to deliver those isolation and quarantine letters, if possible, especially if we have to contact trace quite a few people. And the fifth criteria for public health is that all isolated and quarantined individuals receive follow-up monitoring. We do have staff right now, we're kind of evaluating whether having one person go all the way through that contact with that person would be best, or whether a separate group to do follow-up calls would be best. But we'll continue to look at that aspect. So at our last meeting, people were looking for kind of rays of hope, and I think it's easy to say that there are some, although the majority of our population remains susceptible, our current level of community transmission is very low, which is a great thing. And that low number of positive cases is within our healthcare system capacity, as Kim outlined, with some degree of margin even. Our public health system is scaling up to box in any flare-ups with testing, isolation, and quarantine. And we're focusing on being able to do that for individuals rather than the whole population of Pitkin County. So that's kind of our ray of hope. Our cautions are that the majority of our population are still susceptible. No matter what kind of formula we use for how many cases, still the majority of us have not been exposed to this virus. And this virus thrives where people congregate. So as we open up and start bringing people together for living, working, playing, we've seen from examples in New York City in a dense urban area, on cruise ships, aircraft carriers, meat packing plants, events, discos in South Korea, bridge clubs, long-term care facilities. Anytime you get people close together, this is where the virus thrives and tries and spreads most easily. As Kim outlined, we're seeing cases reemerge in China and South Korea and here in states that have eased stay-at-home strategies. So we need to let our data here, our local data, be what guides us and our state of preparedness. And new cases may lag, as Kim pointed out, for at least 4+ weeks. And if we get out in front of that, there could be some problems. I ended with this slide last time, and I'll do it again, because I think it does point out, we've dealt with viruses that have had higher R-naughts, higher case fatality ratios like polio, smallpox, and 1918 influenza pandemic. And the shortest path to our end game here is going to be an effective vaccine that confers immunity. But we likely need to recognize that 2020 is more of a gap year, as I talked about earlier, until a vaccine is available, and plan accordingly to carefully and slowly allow our population to move about and return to work, accompanied by monitoring, collecting data, testing, isolating and quarantining, and protecting our most vulnerable. That's all I had. I will get back out of this. And if anybody has any questions, both Kim and I are still on. Tori?
Thank you. And thank you for all your work and your presentation. I just had a couple of quick clarifications, and this might actually be, maybe Karen would answer this, but on our construction sites and our landscaping that has come back online over the last few weeks, is part of their safety protocol to alert us if they've had any workers show up that are then sent home because they may be symptomatic? Do they have to report that back to us?
So as part of the safety plan, we've asked that if anyone is symptomatic on the site, that they send them over to ABH for testing. And that actually has occurred. And so that's the protocol right now. And then if they were to test positive, we would certainly be notified around that.
Okay.
And asking them to go home and stay home until they feel better too.
Yeah. Well, I assume from your answer that maybe that's happened, but not a bunch, or we'd probably be discussing that further. So I appreciate that. Charlie, a question for you. Did I understand you to say that we had a confirmed positive case here at AVH, but the person was a resident of Garfield County, so we turned over the contact tracing to Garfield County?
Correct.
I find that interesting. I would think that maybe we would want to take that on if that person was in our community, that we would want to maybe follow up with that contact tracing. I don't know how robust Garfield County's contact tracing is, but perhaps that would be a good case for you to use for the training of our contact tracers. I would think that we'd want to have eyes and ears on that.
We certainly will, coordinate with them, but part of the contact tracing is, going back to where they were exposed originally, which may, and protecting their households. So a lot of that is back in Garfield County. So it makes sense, to really focus on where they live as opposed to just where they might be up here working.
Okay.
Charlie, can I add something to that, Tori?
Yeah, go ahead.
So we've actually been in contact with Garfield County about this case specifically too, just to offer to help out with the work part of the investigation if they needed it. And they just haven't reached back out to us to let us know if they wanted that. But we are in contact with Garfield County about these sort of things to just check in and make sure.
Okay. Thank you. Charlie, you mentioned something about airport arrivals. I didn't understand if you were talking about procedures that were in place now or procedures that should be in place for airport arrivals. You likened it to a welcome to Aspen kit, if you will. Was that your suggestion for what needs to happen, or what is happening?
It's a suggestion, and I'll maybe turn this over to John if you want.
Thanks, Charlie, and thanks, Tori. So right now, we are distributing information, Tori, on our public health orders, and if people are symptomatic, numbers to call for testing and that sort of thing. We are looking at putting together a more rigorous symptom screening process at the airport. That has some real logistical challenges. Obviously, maybe not now because there are just not many people coming in, but we would assume that as lodging or event sizes increase, we'll have more visitors and probably more travelers coming through the airport. So we are working on a process that's scalable for symptom screening and also effective. And a lot of we've seen being done around the country is good optically, but maybe not good in terms of really catching folks who may have COVID symptoms. So we want something that works. So we are working on that. And before we see more volumes there, we anticipate having a screening process in place.
Okay. Just to share some anecdotal, speaking with somebody who arrived in Aspen in the last couple days or a week, they were sharing their story about their flights. The flight that they took from the East Coast to Denver was an absolutely full flight. And then the flight that they, and this is again anecdotal and secondhand information, but the flight that they took from Denver to Aspen, I believe they characterized as perhaps half full. And I hadn't heard that. I hadn't heard that until that was shared by this person. So that was interesting to me. And another question I have for Charlie. Charlie, you mentioned the one of our drawbacks right now about PCR testing is that we are at a 2 to 5 day turnaround time on that. Do you see that improving? Do we have a plan to move that to the 48 or 24-hour turnaround time that we're looking for?
Yes. And I don't know, Kim, do you want to talk about that?
Yeah, that's a great question. And that really is a key part of the whole process, is turning the TAT, or turnaround time of the testing. The hospital is continuing to look at all options to improving that. The goal would be, because right now we have to send this out and then wait for it to come back. The goal would be in-house testing, and we're doing everything we can to accomplish that at this point. Again, it's just limited by availability. There's many companies that are putting this out, and we also want to make sure that we choose the one that has the best sensitivity and specificity, so the lowest of false positives and false negatives, so the most accurate test that we can get and have it in-house, so that turnaround time is low. And many people may realize that we have had for years what's called a viral PCR panel, where it's a very similar test. It's a nasopharyngeal swab, and in-house that's a couple hours, and that tests a variety of viruses, up to maybe 15 or more of current pre-COVID viruses. So there's different options in terms of adding COVID to a test like that, and then also having just a separate COVID test and having it in-house, meaning in the lab at Aspen Valley Hospital. And I see that occurring at some point, hopefully soon. Everything, again, is rapidly changing, and there is a testing team that is looking daily at these options.
And I would add to that, as we've talked about before, in terms of supply chain, we're not at the head of the chain, and it's not a buyer's market for testing kits right now. We can't go out and decide, oh, this is the one we want, and we want this many of them. They're all going to New York, Chicago, a lot of other hotspot areas, and we're just not high enough on that supply chain to be able to get anything that we want anytime that we want.
Excellent
I
point.
appreciate,
Thank you, Charlie.
Yeah, I appreciate that. And would you just, for those that are in the public and also for our education, would you just very briefly, would you explain that a little with a little bit more specificity, meaning where does that supply chain start? Who does Pitkin County have to go to in order to pursue test kits?
Typically, the way it works is that when a company reports that there's availability, you probably have heard of the Abbott Now test, and there's some that are highlighted in the media, and then there's many others that are just coming out. This is such a changing situation, and so our lab will reach out and attempt to order, and it's not, I don't know if they have a priority list. They, as Charlie described, it is absolutely true that they have priorities in terms of the hot spots across the United States. And so when you have one lab that makes it available, they make priorities at hotspots. A small mountain town is not on the top of their list. And so it's a supply demand. And I think all of these labs are making those decisions in terms of where is the most important place in the United States to be sending these. And we're not on the top of that list. And I think it is necessary. I think their decision making is right. And until their supply is great enough to be able to supply everybody, which will happen at some point, it's just a matter of waiting. And so I don't know if that helps out.
It does. You know, I'm gonna, and I appreciate the time. I'm sorry to take so much time here just for those clarification questions. I just want to say a few comments, and it dovetails right off of what you just said, Doctor, is is that, you know, we're in a waiting game. And as we watch our data and we seem to be very reactive, we're not proactive. And I'm not saying that pointing fingers at anybody or our team. The state of this is that we don't have the ability for advanced testing because we don't have the capability and capacity for that. We don't have adequate tracing capabilities set up, and started waiting for the state to do a statewide thing maybe at the end of the month. It's just, you know, it's very difficult because a lot of us would like to be on the proactive front of this instead of the reactive, but it just doesn't sound like we have the capabilities for that. And I think that's a spot for a lot of frustration from the community.
I hear you, and I'd like to actually just reframe that in the way that we are being extremely proactive within the environment that there is. And so you can order tests and place an order, but you can never be guaranteed if that order is going to happen or when it's going to happen. And so we are in the hospital being very proactive in trying to reach out to every possibility that currently exists. And it's just, it's a controlled environment that is, you know, variables out of our control, which we all know are so many within this pandemic.
I appreciate, yep.
We need to move on because
That's my questions.
I know we wanted to talk about wastewater. Can we pull back up the agenda? And then John also needs to speak. Okay. Kurt?
Thanks, Marky. We've had a couple inquiries about wastewater, and I told Karen I could talk for about 2 minutes on that. I've had some information from Dr. Kurt around wastewater, and we've had some inquiries around wastewater epidemiology, which in essence is looking at wastewater and testing it for COVID and seeing if the virus is present there. It's another way to collect some data with some really broad strokes, if you will. So this would be looking at data along the lines of community. Charlie and I have talked a little bit about it. I think I have some concerns about, you know, given all the variables, you know, how meaningful that data can be. Gunnison County started doing this. And so I reached out to Gunnison County and ended up talking with their public health director, Joni Reynolds. And Joni's indicated that they met, and when they had 2 weeks of data, there just wasn't enough information there to find anything useful. They're meeting, I believe, this afternoon to talk about, they have additional couple weeks of data to really talk her through the value of this. And so she's agreed to follow up with me to talk about that. So I'm anticipating that we'll have a conversation and get some clarity on what value they find in this information. I think we have some unique characteristics Gunnison may have, but you know, if you think about Aspen and testing Aspen's wastewater, there are a number of visitors that come in, we have commuters that come in, and you know, we have a number of variables, and how this would paint a picture here, I think, is still a big question mark. So we'll follow up more with that, but I know that's come up a couple of times, and we just wanted to let the group know we're looking into it. But right now, we're going to hold off until we know more information.
Okay, thank you very much. Okay, John?
Sure, thanks, Marky. And I am going to try and share a screen, but I don't think I can do it well. There we go. Okay, are you seeing my screen now?
Yeah.
Yes, okay, good. So I wanted to come back to the board to follow up on the conversation from last week regarding seeking a local variance. And at that time, there wasn't a whole lot of time to go through what that meant. So I just wanted to spend a little bit of time reviewing with the board what a local variance really means, what the requirements are. And then at the end of last meeting, we had talked about getting input from the other entities that needed to approve the suppression plan that's included in the application for local variance, and to update you on those discussions and see where we go from there. So just real briefly, the way Colorado's public health orders have been working, local governments and primarily counties or local public health agencies can choose to enact stricter guidance than the state, like extending the stay-at-home order within the local government's jurisdiction. Generally, local governments are not allowed to have less restrictive public health orders unless they seek and have a variance approved. And in that case, variances are typically sought so that the jurisdiction has flexibility to be less restrictive than the state and to demonstrate how they will continue to protect public health. There are 4 counties in the state so far that have been granted a variance. Everyone's probably familiar with Eagle County, Mesa County, Rio Blanco County, and Sedgwick County have also been granted variances. They've been for different reasons and purposes. The process to seek a variance from the state's public health orders include, we have to submit a written application to CDPHE certifying that the county has low case counts and or can document 14 consecutive days of decline. I think from Charlie's and Dr. Levin's presentation, that's definitely something that we can demonstrate. We need to submit a suppression plan that is also approved by the local public health agency, all hospitals within the county, and a majority of county commissioners, or in the case of maybe a city and county of Broomfield, whatever the county level governing body is. CDPHE then reviews and approves that county-specific suppression plan, and to see if it meets the department's public health standards. And then basically CDPHE will withhold grant funding to any county that implements measures less restrictive than the state public health measures without a variance. And then for counties that do receive a variance approval, there must be collection and monitoring of data that continues to demonstrate no negative impacts on individuals or healthcare systems or services that would otherwise trigger a tightening. In terms of preparing a variance, you need to submit information with the prevalence of COVID-19 within the county. I think we've got a good handle on that. Hospital capacity and usage, which we have a good handle on. Local containment measures being proposed. Again, I think we have those elements in place with our roadmap, but also our COVID safety plan and business plan requirements. The proposed alternative restrictions being proposed. So what portions of the state public health order and executive orders is the county seeking to have a variance from? And then the conditions and standards used to that the county, the local government would use to determine if the variance is continuing to provide protection of public health equivalent to the state public health orders. And then counties are prohibited from seeking variances to public health orders that protect vulnerable individuals. After the last Board of Health meeting, where it was suggested that the county seek a variance that would allow restaurants to partially reopen as early as next week, May 20th. Data is still supporting. We engaged in discussions with the hospital and Board of County Commissioners to get a sense of the position of those agencies on a variance request. The hospital ran the question through their medical advisory team, and the medical advisory team brought their recommendations to the AVH board. I know Kim was involved in those presentations, and so can probably answer questions about that. But there are really two summary points that came out of that discussion back to the county. And that's that the medical advisory team and the AVH board strongly supports the roadmap and the 5 criteria that Charlie discussed in its current form. They also noted that there's still work to be done, and we're doing that work right now with the hospital and medical advisory team to continue development of triggers and measures related to those 5 criteria. There is also a discussion with the medical advisory team and AVH board recognizing that moving the variance to move to the 20th for the partial reopening of restaurants would be a deviation from the roadmap. And the concern was that it did not allow the amount of time that physicians feel would be necessary to really see if there is a spread of the virus. And that was specifically related back to what Kim was talking about, giving the minimum of 4 weeks for two generations of the virus to both spread and be detected. But AVH was also very careful to note that it really is not within their purview to comment on the economic conditions or broader public policy considerations that the Board of Health may be taking into consideration. They really were focused on providing their advice from the medical perspective. Yesterday, the Board of Commissioners also met to discuss their position on the proposed variance for restaurants. And I know Greg and Patty were both part of that conversation, so could probably help answer questions here too. But the outcome of that discussion was fairly similar to where the hospital board and medical advisory team was coming from. They expressed support for the roadmap and the criteria to move between phases. They supported, in line with the medical advisory team, moving to the phase 2, which would be inclusive of restaurant and lodging reopening with guidance and with COVID safety plans on May 27th. Again, assuming there's no change in the data. Our data is very favorable right now, and it's assuming we don't see new trends between now and then. But there is a broader conversation where the board directed staff, me, to pursue a broader variance, not necessarily one related just to restaurants or an earlier opening date, but a broader variance that would allow the county to implement the roadmap to reopening and county suppression plan according to those criteria, and not necessarily relying just on the state orders. And I think some of the concern there is the state orders and direction tend to come with a pretty short notice as far as what they're going to be before implementation. And those decisions aren't necessarily made with consideration of local data and conditions versus what's happening on a statewide basis. Some other perspectives and just understanding, I'm sorry, this slide got a little bit out of alignment. It's probably a little odd to look at. I did promise you we'd have some sloppy slides with these meetings every week though, so I hate to disappoint. Other perspectives though, City of Aspen, they discussed at a meeting earlier this week, the Board of Health variance request. The outcome of that appeared to be that members were split and really needed more information, it sounded like, and have requested county staff to do a presentation next Monday. The City of Aspen obviously has representation on the Board of Health. They are not in the required decision-making loop for variance through CDPHE. Eagle and Garfield counties, in our discussions with Eagle County, they have received a variance. Eagle County right now is very closely aligned with where Pickens County is on most issues, including the lodging now, as well as restaurants. They are looking at restaurant reopening as well as lodging reopenings as soon as May 25th. They too are continuing to watch their data to see if there's any spikes or indications that those dates should be moved. We understand that Garfield County is seeking, sorry, this should have been a variance instead of exemption. I've been using those two terms interchangeably. Variance from state executive orders and public health orders for restaurants. We understand probably using the Mesa County model, hot springs and the amusement park. We don't have, at least at the time we put this together, didn't have much more detail on what that variance might look like. We also got indications from the state about when we can expect decisions. Now, this doesn't mean that this would be necessarily a reopening or resumption of activities, but when we can expect to hear from the state. May 25th, they projected we'll hear whether restaurants can begin to reopen under the state public health order and at what level, whether ski resorts can open for spring skiing pursuant to county approval, and whether summer residential and day camps can open in June, and if so, under what conditions. After June 1st, they've projected that we'll get further guidance on the state safer at home order and modifications for the summer. So with that, it appears that with all the entities that need to come to agreement, there are really two options at this point. The first would be to align with the direction that the Board of Commissioners gave to staff yesterday, and that's direction to pursue a broader variance. And I'll talk about what that might look like in a second, to allow the county to implement the roadmap to reopening based on meeting the 5 criteria locally versus based on state public health orders. Again, phase 2, we anticipate would be reached on May 27th. And again, I can't emphasize this enough. As Kim said, the criteria are data-driven. And so that assumes that the data continues to be favorable to that decision. And under that variance, Pickens County may be more or less restrictive than the state, depending on local conditions and measurements on our criteria. The other option is to continue in line with the state public health orders. That would leave us the choice to be more strict on certain elements, but not less strict, as local data indicates, and no variance would be required there. Any local variance, even a broader variance, this would probably be modeled a little bit more on the variance that Eagle County pursued, to pick certain categories of restrictions in the state orders that Pickens County would seek a variance on, and more local control pursuant to our roadmap to reopening and our suppression plan. And so that would probably be looking at areas where we have the most economic impact, and that would be areas of public accommodation, which would capture your restaurants and bars, non-essential retail, and another example right now is escaping me, but there are major buckets within the state orders that are more in the purview of what's affecting our local economy, that we'd seek a variance on, and then make policy based on our reopening. The disadvantage of that, obviously, is that we have a fairly small local staff, and so the more we customize, the more challenging putting all of that guidance together for our community to follow is, versus aligning with the state. The pros on it, and I think the reason that the Board of Commissioners was interested in seeking the variance in those major categories, is it gives us a more predictability and control over how we craft our public health orders and our reopening to what actual local conditions and data are. And so with that, Marky, that's the last slide I have for you, and I could take questions, and I'd invite board conversation on how to proceed.
Okay, thank you very much, John. And I want to try to get back on full screen so I can see.
Yeah, let me, sorry.
Thank you so very much.
Yeah.
What concerns me, John, is not that it might be a great idea. We have a very small staff, and the concern becomes one of expectations, managing expectations of the community, as well as realistic expectations of our staff. I think we would need more help to put this together. The suppression plan is not fully complete, as we just heard. I'm really torn personally, but I'd like to hear from the other commissioners who were in that meeting.
And Marky, I know while they're finding their mute buttons, if a variance is granted, we still have the option of aligning with the state order. And I just think it makes that conversation that you brought up about what do we want to take on locally versus relying on that broader state direction more important.
And I see Brent, you unmuted.
Oh, well, I just, a couple of things. Number one, it seems to me that we're such a small community that our database, I'm not a mathematician or a statistician, but I'm a little afraid when you don't have massive amounts of data, you can easily misinterpret what you're looking at. So number one, I'm a little afraid that we have such a small database, difficult to make decisions, that I think we said the community transmission rate is low. Yes, until maybe the beginning of June or middle of June, and then we become a whole nother animal when we get an influx of people coming that we have no idea what their state of health is. And the third thing is that in the protocols, number 4, which is the strategy of wearing a mask and social distancing and so forth. I've just seen that break down so many places. It's just inherent in our nature to maybe be optimistic or to be free. And what I was going to say, I was going to say this later, but does it make sense, I'll put it that way, to use the Pitkin County alert system? We talked about, talking about at the airport screening, sending out a massive blast to everybody on that, and this is an emergency, right? Every Saturday or every Sunday, just saying, it's not over, it's not over, remember to wear your mask, remember to keep social distancing or something, because I'm afraid that's where it's going to break down, or at least one of the places it may break down. That was it.
Thank you, Brent. Back to other county commissioners who were in the meeting yesterday. Greg?
Sure, thank you. As you can see, it's a moving target. We've got to and I appreciate the hard work everyone has been doing so far to get it and also deal with federal and state to deal with an entity. I think that, of course, is some sort of certainty about something. And so I've got a series of questions here. I'll be quick. I've got a question from a fellow commissioner also. And the question is, what can we be doing to pivot with best practices regarding our economy? I think we need to adapt years of sounding estimates that are between 18 months and never for actually developing an antiviral for this thing. So if we're going to shut the economy down and wait for an antiviral, I think that we might be tragically disappointed, one, by the economy before any sign of the antivirus arrives. So what I'm wondering is it going to be up to public health to help us pivot to the best practices to help our economy? What kind of certainty can we give our businesses, hotels, restaurants, whatever, to help them prepare for the eventuality that they can reopen? I know hotels are frustrated because they can't even take reservations, or I think they assume they cannot take reservations right now. Can we at least allow hotels to take reservations with a complete understanding that and have to cancel them if the orders dictate that? Can restaurants begin preparing to be ready for a summer and thinking about what they're doing in advance of this reopening? So I'm thinking there are things we could be doing, even though we know it's way out there. Something else to ask or mention is that I hear us coordinating with the state regarding things like contact tracing software and diagnostics. It makes great sense to have the entire standard throughout the state. But I also wonder, it sounds like we have people for ways of doing things as we coordinate. I know we have people, for instance, who has some great ideas that I'm hoping someone can vet regarding. We put in suggestions, and I appreciate Kurt and everyone addressing my. But I do want to make sure that on one hand, we're not waiting for the state to tell us what to do, but on the second, we're talking about trying to find local solutions. So I say I'm hoping we have the bandwidth, whether it's through volunteers or through additional help, to keep for local solutions, along with waiting for the state to make a decision. If I can, I'm going to ask, we have a question, a specific question from my associate, Kelly Curry. I think the question was partially answered, but I want to drill down more. If Garfield County does the contact tracing and identifies contacts in Pitkin, are they going to be handling and directing the quarantine county resident, or is that responsibility handled over to our department? And I'm not sure I heard the answer. Maybe you already said it, but Charlie may have already said this.
Charlie or Karen?
Oh, go ahead, Charlie.
In this particular case, there was, it was someone who lives in Garfield County, so that we would be looking to them to issue the isolation and quarantine letters there, because that's where their residency is. They do have support for them there too, in terms of getting groceries or prescriptions or other things that they would need. We have the same up here, in Pitkin County, but if they could be closer to home, and they also have to deal with their household members as well. So most likely they would be quarantined in Garfield County.
Right. I guess my resident, they're identified by somebody out of Garfield. Will the case be handed over so it's in our county?
Yeah, they would hand it back
and
to
managed
us.
by us.
Yeah, they would hand it back to us for sure, if it was a Pitkin County resident.
The way that contact tracing goes is, and this is a procedure we collectively have had in place for a long time, is that the county of residence is the county that does the investigation, and they coordinate with other counties if those folks that are in that chain of transmission are in other communities, but they do the full contact tracing event. So they start from the person one all the way out through the chain of transmission and can connect with maybe where other people live, but they are the ones that actually issue the isolation and quarantine all for that whole chain.
So we'll have
Sorry, Greg, you're really cutting it.
Hey, Greg, I wonder if you cut your video off. I think your internet
yeah,
might be running a little slow. You keep cutting out.
Well, I just lost.
We have a free, or at least an open data sharing. My God.
I just lost it.
I'm going to text you, Marky. How's that? I'll text you the final question.
Okay.
And maybe Patty can fill in if she.
I'm coming back up.
Marky?
Yes.
Since I was at the Board of Commissioners meeting yesterday, I want to bring it back to the issue of the variance.
Yes.
Board of County Commissioners was coming from. John was absolutely right. It was our effort to have local control and to have a variance in place if we were to need it, rather than to need it and not have it, and then have to go to the process of applying for it. It was more of, let's be prepared, so if an issue comes up with our ability to follow the roadmap plan that we have in place is interfered with at the state level, that we can take that control back locally. And I don't think we need to make a big, huge effort in applying for this variance. I think we can do so very simply. We have so much information on our roadmap plan now. Submit that. All we need is a letter of support from someone at the hospital that says they support the suppression plan. They have the capacity, those 2 points, to handle anything if need be. And that letter gets attached. And then I'm not actually sure if it's applied through with the Board of Health as the applicant, or the Board of County Commissioners are just a supporting entity. But we don't have to make it a big drawn out lengthy procedure. It's an online application. I think we can try and keep it as simple as possible. Hopefully we'll have that variance in hand if we need it in the future, so that we can take control locally and do what's best for our community.
Thank you, Patty. Just a quick question for Karen. You and Charles have been working on the suppression plan with your staff. How much more work is there to be done on that suppression plan? Because that's the key in the ability to do the contact tracing and everything else. Karen?
Yeah, sure. So some of the information that Kim and Charlie shared with you today is part of that suppression plan. It certainly doesn't hurt us to put together a full-scale suppression plan for the community, regardless of what we're doing with variances, just to show where we're going. So I think that I would say, and Charlie, you can please weigh in, but I would say we're probably 25, 35% in getting a full suppression plan in place, like writing it out. But what do you think, Charlie?
I think we have a lot of the pieces. It's just bringing them all together and putting it in the format that's needed.
Now, so the looking at the detail that's been submitted by other counties that have received the variances, those pieces I think we have in place. I think what Karen and Charlie are talking about is our continued process to really build our processes and our capacity going forward. So we've got more than a lot of counties out there right now. And I think to Patty's point, although I think it's going to be a little longer, Patty, than we might think.
I'm the optimist here.
I know. I do think we've got a lot of those pieces already in place for the purposes of pursuing the variance. That does not mean we still don't have a lot of work to do over the next few months to really make them effective.
Exactly.
Quick question. So you were talking about May 27th or May 25th. What was it? May 27th?
27th.
What are you talking about? What do you mean, May 27th? Is that when the restaurants and the lodging?
Yeah, so.
What capacity?
Yeah, so thanks, Marky. And just this was the other piece of the conversation from our last meeting. So the expiration of our current public health order is May 27th.
Right.
And we are anticipating that based on the data that was shared with you today, that, you know, if those trends continue and we don't see a significant change in that data, moving to the phase 2 of the reopening. So that would be an amended local public health order. That amended order right now, according to our roadmap, we're anticipating would include lodging being able to reopen with guidance, right? And so it's not going to be a 100% on switch. And in fact, just a comment, Greg had said there is some confusion about taking reservations. We did try and correct that with the new public health order, and I think lodges are taking reservations for the 28th, with the understanding that if their data changes, our roadmap may change. And so, yeah, so Marky, that would be limited reopening for both lodging and restaurants according to our roadmap. Karen, I probably jumped in front of you on that, but that was from our last discussion at the last Board of Health meeting.
Yeah. And we are really trying to talk with Eagle County in particular, but Garfield, to best align some of those strategies for reopening. So when we think about, I think the lodging community has proposed opening at 35%, I believe, on June 1st. That's fairly in line with what Eagle County is looking at as they start to open up their lodging. And then for restaurants, we've been in conversation with Garfield and Eagle to try to have similar guidance so that our community isn't confused when they go or, you know, for basalt that's kind of stretched between two counties. So we really are trying to align some of these strategies with our neighbors as well.
So is that at 30% or 50%, Karen?
And there might be someone on here that can answer that accurately, but I think it's 35% on June 1st.
Okay.
we can.
Yeah, so right now we're working with sectors, Marky, on that guidance. The draft that's being considered for lodging is at 35% occupancy, and I think the recommendation was for June 1st. I know some lodges though are taking reservations, anticipating that the public health order may be permissive on the 28th. And so we're still working through some of those details right now. As far as restaurants go, again, very much in draft form. And we need to revisit some of this. What other counties have done is establish a percent, for example, as a percent of fire code for inside seating, and that's a number that's being discussed right now. We still need to have a discussion. I think the goal is really the ability to physical distance within those spaces, and it may be more appropriate to focus on those metrics versus a percentage of fire code. But those are discussions that are going on now. I would say all of these sectors have been really responsive in trying to develop plans that meet both the public health needs and bringing their understanding of their industries to the table. And so those guidelines are under development for the 27th, and we're trying to work with our stakeholders as much as possible.
Okay, I don't think we need to get into all the detail. I also got a text just now. Does lodging include condos?
So I think the goal, and this is the language that we're working on now, is professionally managed. One of the keys to this is going to be that we've got a point that is responsible for developing and implementing COVID safety plans across those units. And so I think the professionally managed condos, and I know Snowmass, for example, Marky, a lot of what looks like a hotel is actually professionally managed condos. We'd anticipate that with a COVID safety plan and a responsible professional management entity, that those groups will be able to open under this. But for condos that are just one-off VRBOs or not professionally managed right now, I don't think we're anticipating those being available on the 27th. And Karen, I'm looking to see if you're shouting at your screen or not now.
Well, and I know Kara and Jordana are on here because they were going to do a whole presentation on these business safety plans and what they've been doing. So I'm going to allow them to jump in and add to what you just said if they're still there.
I should have looked at the agenda. That's that's better.
Let's go ahead and jump into that because this is a very important part of our discussion today. Dana, and who's the other one that's on it, Karen?
Jordana and Kara have been working really
good. Let's pop over there.
So I think it's really important to differentiate, as everyone discussed, that we are in this process of giving guidance once we get where we're coming from. So far, the consumer, the compliance and business safety checklist guidance has all been focused on this phase 1, what has been allowed to be open. So for us to give guidance on this next phase, we're still waiting for what the state says, if we're able to move to the next phase, and that guidance that John's working on coming out of these industry groups who are coming together and really talking about what makes what do they think as an industry is a safe way to open, and then public health is able to review those guidelines. So that's where we're at specifically with the lodging and the restaurants that will be considered in phase 2. I don't know if you want us to jump into the components of the business safety checklist and compliance and what we're currently doing.
I think that might be interesting. How about Karen? Isn't that what we talked about?
It is, yeah.
And I would just jump in to tag, just to close the loop on where we are right now with the lodging and restaurant sectors, is that our business liaison is working with those groups, and they are actually refining that definition actually. So to go back to the condo question, they're working on really clearly defining that definition so we can make it as clear to the community and all the different condo owners and businesses once we get that guidance.
And Kara, would you introduce yourself for those who may not know you?
All right. Hi, everyone. My name is Kara Silbernagle. I'm the Policy and Project Manager at Pitkin County, and I've been working with Jordana on the recovery side of things as it relates to the business protection or the business safety plan and the consumer protection program.
And just a question, Marky, if I could for a moment.
Yeah.
Thank you. On lodging. When we met last time, I think there was a little confusion. The group said they were comfortable, obviously assuming the data stays as it is, with not just opening on the 27th, but not booking until the 28th. And that was a little confusing. So are they able to book today in advance on the 27th or 28th is the question. I know the order expires at midnight on the morning of the 27th. So today, can you book on the 27th or 28th? That's just a clarity.
I'll have you answer that one, or Karen. Or Jeff.
The 27th. The current public health order runs through the 26th. And so the 27th is our anticipated date where we will be moving into phase 2. So you can
phase 2. Okay, so you could take on the
arriving on the 27th.
Thank you for the clarity.
And John, I've got another question coming in for condos. What do you mean by professionally managed? Or Karen?
So I can jump in. The definition that we're seeing floating right now, and I think it's been used in other industry practices, is essentially professionally managed, meaning that there's a property manager that the listing might be on a VRBO, but actually it has facilities are cleaned by a third party or a property manager, and that cleaning happens in between those uses.
Okay, Jordana.
All right, I'll share this presentation here with folks, and Kara is going to
so we had discussed bringing forward just an update on the business safety plan checklist and the program. I think some of this has been hit, but can you go to the next? Can I drive, or do you have to drive, Jordana? Okay. So again, the roadmap to reopening, really hitting on these 5 commitments of containment, making sure that these are the foundation in any business that might be reopening. It's really maintaining the 6 feet distancing, washing the hands, covering the face, staying home for employees and customers when you're sick, and testing immediately. And just we want to make sure that these continue to be the foundation as we move forward with any phasing. Next slide. So, so there's really a process that we've set into place of how businesses can open in a safe way and who can complete it. Again, it's all called out on the roadmap to reopening of who needs to complete the business safety plan checklist. Within that checklist, it really mirrors those 5 components. And so we're really trying to focus on making sure whichever your sector, thinking about these foundations, which is how are you protecting the employees' health? How are you promoting the clean hands? Really thinking about effective disinfection protocols based on your industry or sector. Again, promoting the social distancing and really trying to think of how do we reduce the unnecessary contact and touch points throughout all the different operations of a business. reducing the exposure through transportation of both employees and any customers, and really maintaining that aspect, and really to hit home on the purpose of this is to ensure the safety of our employees and our customers and our community, and that we want this plan to become the new normal of how are we communicating, what are the changes in protocols that are taking place, how do we share that with all employees, and really promoting that once we continue to, as we move through the different phases, to be able to share with anyone that might come here is that we have been safe, we are a safe place to come, we're protecting, you know, the Aspen Pitkin County brand, and that we want to continue to make this a safe place moving forward. So one of the key components, if you move to the next slide, Jordana, is that once you submit a business safety plan, that as what you submit the business safety plan online, and every business that submits one will get this sign. And this is our essentially key to our community members, that this business is a safe place. They're taking this seriously. They've implemented the protocols necessary, and you can be assured that they are taking this process and are a safe place to enter. The other piece that is important for the community to know is that we're requiring every business to have the business safety plan on file and available. So any consumer that walks in or employee is able to ask for it at any point if they have questions. Next slide. So this is all a new process. We're moving into the new normal. There's lots and lots of questions, and we are building out the consumer protection program to offer that assistance. And so where do you go? First place is we're continuing trying to update and clarify the roadmap. So we've even added in some clarifications for institutions. We're regularly updating the FAQs as we all learn. We're all learning and getting more clarity, and so the FAQs are updated regularly. And then really looking at the state guidance by sector through the Department of Regulatory Affairs, and the FAQs are also updated regularly. So that's a good place for guidance. And then otherwise, you know, please reach out to Business Liaison at Pitkin County. That is where we're really funneling all those questions, because the more that we centralize those questions, the more we're able to actually all collectively learn together the answers and build the guidance and clear direction for the community. With that, I will hand it to Jordana.
Thanks, Kara. So I wanted to share some of the things, some of the outreach efforts that we've been part in to reach out to our businesses and local community. The team that we have working on this is 7 people strong. We fielded over 150 questions to that business liaison email since just last Thursday. Last week we held 2 town hall meetings. The first one had 200 participants. The second one had 100 participants. And Bob, our business liaison, has really been working with a handful of industries, industry groups around really being an advocate and thinking about what are those guidelines that work for that industry for us to be able to consider in phase 2 and beyond when we are looking at relaxing some more of these public health orders. The process. So today, when you leave, we really want you to take to heart this email, businessliaison@pitkincounty.com. You'll learn how to spell liaison. It's a tricky one, but if you get it right, your email will come to this group of subject matter experts, where if you have a business question, a question on the public health order, it's going to get funneled to the correct subject matter expert, so you can see where we're developing expertise in all of these areas under COVID with regards to construction and landscaping, general public health questions, specific questions for outfitters and guides, personal services, outdoor recreation and retail, safety protocols, disinfecting, general environmental health questions, so childcare, restaurants, summer camps, and then general FAQs, businesses in the safety list, schools, public health, order processes, and others, as well as community institutions and professional services. So we are learning and developing protocols every day. So your question will get funneled to the correct expert. Then if that question can be answered with already existing FAQ guidance, state guidance, or county precedent, we'll get you an answer right away. If not, we're gonna have to go back and do some research. We've been compiling this research based on similar guidance that we can find potentially in our neighboring states or other organizations that represent some kind of industry. We're looking at it with this public health rationale. And then the public health, we have the subject matter expert gets together with our entire team to make sure that the decision is sound and follows those principles. And then once we have that answer, we get it back to the person who answered it and update our frequently asked questions with that general guidance so that anyone else who has that same question can access it there. So this week, as I mentioned, we've really been working on continued guidance for this phase one, this current phase that we're in. And we want to be able to be looking forward, thinking about what's coming next, what's going to be opening in phase two, how can we get people information to be able to prepare for what that might look like. So that's on our radar and what we are planning to do. We thought we'd just share this this graphic with you because it really allows us, we're hoping that it gives you some sense of how one of the ways that we're thinking about risk tolerance, and when we're making these decisions, what is appropriate guidance to be giving in phase one versus 2 versus 3. So in phase 1, we're really looking at what are these least risky, low touch environments with individual activity and how can we make those as safe as possible. And then moving through to the riskiest kind of activities that we'll reserve for the later stages and phases of opening are where you have high touch environment and a group activity. So this is just one of the kind of scales that we use when we come together as those subject matter experts to consider these decisions and that guidance. So again, for more information, that COVID website continues to be updated, and we will stop sharing now and see if there are any questions that we can answer for you.
I do have a question, Jordana. This comes from the arts organizations, whether it be music or theater or what have you. In which bucket would they be sitting?
Great question. So it just depends on what they are attempting to do. If they're or just getting people together, special events. If they've got questions, email it to businessliaison@pcr, and we will work with them to either set up an industry group or work with where they would fit in this phase.
We're trying to, the reason why I bring that up, this one comes from JAS, Jazz, the Summer Cafe Series. So I'll direct them to you.
Okay.
Okay, other questions? Okay, I do know it's 3:27. I do know we wanted to talk a little bit about mental health. We have a few minutes to
Marky, if I could ask a question, I'm still not clear on the variance request and the Board of Health support to follow through with the direction from the Board of Commissioners. Sorry, I just want to make sure we get that.
Okay, I have many questions coming into my iPhone. Anyway, I'm very supportive of it. How about the rest of you?
He gave two choices there, I believe. Were there 2 options, John?
Yeah, really, Tori, I think given the direction from the commissioners and kind of the input from the hospital, one is to seek a variance to allow us to implement our roadmap per our criteria. The other would be to not pursue a variance aligned with the state, in which case the county still has the option to be more strict, but never more lenient than the state orders.
John, can I just clear?
Yeah, okay, Kimberly?
I just want to clarify something. So my understanding is that the board needs to vote now on whether we're going to pass this quote broad variance. And the broad variance will give the county the flexibility to be able to go looser restrictions on many variables, not just restaurants, but also lodging and other things that we may decide if we would like that. Is that right? And that would happen on, we'll find out from the state what direction they're going in on the 25th. And this variance will start on the 27th for us. And that would give us more flexibility. Is that right?
No, let me jump in here. No, the variance, we have to receive a variance, first of all, which could take some time because other counties are queuing up to get into this process. It would be just a tool that we would have if in case we needed it in the future to do something that was more specific to our roadmap, our plan that we have locally. It gives us that opportunity. And if we wanted to be more lenient, it would still have to go through a process with the Board of Health and looking at our data and all our statistics. It wouldn't just be, willy-nilly, but it would be something we would have in case we needed it in the future, rather than having to say, oops, we should have had a variance in order for us to be able to do this on a local level. That's all.
The whole notion is to have the quiver in your toolkit.
Got it.
And did you discuss whether that would just apply to this next step or what the termination of this would be, what that would look like?
So yeah, Kim, so you have to identify which orders you're seeking a variance from. So as the state issues new public health orders, if those conditions change, it may be that we need to resubmit. I know Eagle's finding themselves in that position also, but if the safer at home order is to continue as it sounds like it might into June, then our variance would apply if, and that's a big if. We, to Patty's point, if I'm hearing you correctly, Patty, is we would align with the state where it makes sense, but there may be areas where we want to be stricter, which has been the case.
Which we can do.
And there may be areas where we want to be less restrictive, which is, depending on how our data is showing up, that may or may not be justified, but it gives us the flexibility to do both then.
And John, let me add too, we don't really know, since we're applying for a variance different than other counties, we're applying for a variance on a more broader spectrum of being able to implement our roadmap plan. So it may or may not be, we don't know that for sure, John, it may or may not be tied to a specific state order. We may be able to broaden that. I don't think we've asked that question yet to the state.
Okay, so the question becomes one for the board. Are you supporting a variance application for a broad stroked variance? And if so, I would ask for a motion accordingly.
Further discussion or anything? I saw Brent's hand went up. I'd like to make a comment if I could before we vote. So if I may, I'm going to speak on my behalf. My city council is primarily concerned. Priority number one is health and safety. Let me be clear about that. My concern here is twofold. One, if we wait for the state to tell us what's up, we don't know what's going to happen there. And the state may say restaurants can open to 100% capacity. The state could say 50% capacity. In either case, that's for the city of Aspen. That's a lot. That would be a lot to come online quickly. And I don't know that we locally are going to have, the political will or the capacity to limit that from the state. So on one hand, I'm concerned about, you know, the idea of a later but larger opening. I don't know that that works for us in the safest methodology. Eagle County opening on the 25th has a nod towards that safe and slow opening. You know, when we talk about restaurants don't just, they're not going to just hear a health order and then the next day be ready to go on any of these fronts, whether it's staffing or food supplies, getting open, making sure that their safety protocols are in place. These are all things that take a little bit of time. So I'm supportive of the variance request and the broad variance request that's being put forth here, but I still advocate for, you know, kind of giving some information about what that could look like as we lead up to that 27th. Again, all of this is going to be dependent on the data that we are getting out of the hospital and out of our tracking. So, you know, I just want to say that, you know, in my efforts to do the safest and smartest opening is why I really look for that slow on-ramp, and I hope that that's in consideration for this variance request. So I do support the broad variance request that is being put forth as option number 1.
Okay, Brent?
I was just going to say the same thing, really, that Tori said. I'd like to hear the argument against us having the ability to have a lot more power in this respect. We can always conform to the state, but I think we don't want to get caught in some sort of bureaucratic crosstalk in the future when time is of the essence. So I would say we would want the variance to be able to act quickly if we so decide.
Well, not to be argumentative, Brent, but I'll try and give you the cons on the other side of this. And yeah, I think the real issue is there is a tremendous amount of detail that goes in to the guidance and public health orders. And we also live in a valley with multiple jurisdictions. And so to the degree that folks are aligning with the state public health order, we're able to push out FAQs and those sorts of things to the state versus customizing those. And so having that control, the more we customize away from the state, the more resources we're putting towards that. And it can be confusing for our community. Now, all that said, the state guidance has been catching up, and so I suspect we'll probably be recommending aligning with a lot of the state, but they've also been really late to the game sometimes and have not provided a lot of clarity. So that would be the argument for pursuing the variance, just to get more control of our own destiny. But if we get the variance, I think it's going to be staff's recommendation, try and align with the state as much as we can when it makes sense, so that we can rely on their guidance and their deeper bench.
What you're saying is you're not objecting or you're in favor of the principle of the variance. It's just what comes with that is great responsibility and the potential for more confusion, and also even the conflict with surrounding counties. So
yeah, and I was just you had asked for some arguments on the other side, so I wanted to present those.
Yeah, and let me just add to that. Our goal is not to create more confusion, not to create more work. Our goal is just to have this in our toolbox in case we need it in the future, which would simplify things, I believe, in the long run.
Okay, any other questions? So I'm looking to board members to see if there's one person who might want to make a motion accordingly to one or the other option. Greg?
I'll try. Let me know if I'm not breaking up. Okay. I'd make a motion to accept the variance as proposed. And I think that's enough right there.
Do I have a second?
I'll second that, Jeannie.
Jeannie seconded. Any further discussion?
there's positives and negatives to all this, and I'm just
yeah, pros and cons. This is a tough one.
I just hope this doesn't put us in a position that is not manageable. I really think that slow starts for this is the way to go, and I hope that this doesn't backfire because the state is going to do something that is not appropriate for our area, and that could be either direction. I think having local control on this is where we need to be.
And that is the motion, is really trying to put our destiny in our own hands. Pickens County is pretty darn unique. And one example the other day was all of a sudden, Polis decides people could go camping. I'm going, what's up? I mean, that was like 3 days notice. But anyway, okay, I've got a motion on the table. I've got a second. Any further discussion? I'm going to call for the question. All in support, raise your right hand. Okay, that passed. I know that it's late, it's 3:39. Well, I'd really like to hear the mental health aspect here.
Marky,
I've got a 4 o'clock meeting.
Yeah, Christina had to hop off because she had an appointment at 3:30. So we have asked her to do a presentation for the meeting next week.
That's great.
So go ahead and do that.
The other thing that we'll pick up next week, many of you are getting questions from various community organizations and various businesses. Let's channel that into next week as well, so we can get a roundtable going on what are all the questions that are coming forward. I mean, I've got one right here about taxis, and I mean, it just keeps going and going. So let's funnel the questions in the chat. There's a lot of questions as well. So I'm going to ask Karen and her staff to respond to those. Tori?
Yeah, I appreciate that. The one question that didn't come up today that I was hoping I was going to hear from about is the change from the IMT to the EOC.
Oh, yeah. You probably read about that in the paper.
Tori, do you want us to just take some time next week and explain that process?
Yeah, I was through it if you needed to go through it, but.
Yeah, I'd like to understand it better at some point, that's for sure.
Well, let's do it next week, okay?
I'll probably do my research before that. I need to understand this prior to a week from now. So I'll get online with somebody else and find out what this means and how this changes communications or direction.
Sure, and just a heads up that I believe that both Valerie McDonald and Phyllis did a Aspen Daily News interview with Oliver today. So there's a little bit of information out there. I know they did an interview with Andre, and I recognize that that's media coming at you, but there is some, and then we can connect you to Valerie and Phyllis ahead of time.
Yeah, great.
Let's do that. That would be great. Thank you. Okay. With that said, do I have a motion for adjournment?
I'll motion to adjourn.
Okay. Do we have a second?
Second.
Thank you, Brent. Okay, all in support, raise your right hand. Okay. Well, I tell you, this is a fluid process. That's all I have to say. Thank you,
Mark. Good job.
Presentations today and all the wonderful questions coming in on the chat box or comments. Great work. Thank you.
Thank you, Marky.
Thanks, Marky.
Thanks.
Bye, everyone.